The subject of this video is your sleeping position. I wonder which position is the best for me to sleep on for my heart, organs, intestines, or neck. Many people are asking themselves this question: who should our video be about and which side should they lean towards? At the end of this video, you will decide which side you want to lie on yourself. When discussing sleep positions, people often claim their sleep position is the absolute best for them. The position you sleep in may be making you ill. It may be the most beneficial position for your health. In general, it is known that sleeping on the side is a better habit. Are those who lie on their backs doing it incorrectly? Should people lying face down change position? We will discuss one by one which position is better in which situations. Because sleep is very important and we spend 1/3 of our lives sleeping. If we cannot turn sleep into a complete state of rest, we may experience pain due to sleep during the day. The risk of some diseases may increase more due to improper sleep. Our first position is side sleeping. Begin with a nap on the left first. Usually 60% of men sleep on sides. In women, the rate is about 40–50%. Men tend to spend a large part of their sleep on their side. I can say that the side sleeping position is generally the healthiest position. I said generally because the same sleep position isn't recommended for all. For instance, if you struggle to sleep or have acid reflux or are pregnant, we generally recommend side sleeping. For heart disease, we recommend lying on right side because when we lie on right side, heart will be slightly higher, return to heart will decrease more, and thus heart will relax more. Some studies on heart health suggest that lying on the right side has a more positive effect on the heart. Individuals with spinal problems often benefit from lying on their side. If you have a weight problem, you can place a pillow between your knees to prevent them from touching each other and provide support. If you are lying on your side and you are satisfied with it, if you are not waking up with any pain, or if you feel that what you eat does not come to your mouth, you generally do not need to change your position. If you have reflux, it's better to sleep on your left side. If your intestines are full when you lie on your right side, it's easier for it to come to your mouth. If you have issues like reflux or gas, and if you feel like your nose burns after eating, it may be more beneficial to lie on your left side. If there's a condition like heart disease or failure, it may be more beneficial to lie on the right side. Pregnant women should lie on the right side. Usually lying on your side is a suitable position. Most people already sleep on their side. But when you lie on your side, if you have a weight problem, you can put a pillow between your knees to reduce the pressure on them. I can say that the best position for snoring is to sleep on your side. Side sleeping is the sleep position that minimizes the risk of snoring the most. If you are experiencing severe hip pain, or if you feel pain on your hip or thigh bone when lying on your side, then you have the option to choose to lie on your back. You don't need to worry about having to lie down in such situations. The position you wake up without pain is the best position for you. A concern for side sleepers is the presence of wrinkles on that side. Yes, this is indeed true. If you are concerned about wrinkles on your skin, then lying on your back may be better for you. But as I mentioned, for optimal health, sleeping on your side is generally better. If you see your shoulder stuck and your arm numb when lying on your side, lying on your back may be more beneficial for you. If you have a neck herniation, nerve compression, and experience pain and numbness due to nerve compression when lying on that side, then lying on your back may be a more appropriate position for you. Let's discuss lying on your back. Supine position is the second most common sleeping position. People sleep on their backs when not on their sides. Sleeping on your back increases the risk of sleep ablution the most. If we lie on our back and if the pillow is slightly lower in position, that means you are probably going to take a sleep ablution. Because the position we lie on our back is where the airway narrows the most. People I can recommend to lie on their backs are patients with a stuffy nose, sinusitis problems, and those who suffer from breathing difficulties due to nasal congestion. If you have a condition like the flu, if your nasal airway is blocked and you have difficulty breathing, lying on your back may be more beneficial for you. Because when you lie on your back, the congestion in your nasal passage and airway will move in the opposite direction. And you'll ingest it in your esophagus unknowingly while asleep. You'll do this by swallowing without noticing it. However, when lying on your side, it is common for one nostril to be blocked. When lying on your back, you can ensure that both nostrils are open to their maximum capacity. People who suffer from back pain and neck pain often find relief from lying on their back. Lying on your back usually reduces pain complaints in this person. If you are experiencing neck pain while lying on your back and you are accustomed to this condition, I recommend using a memory foam pillow if you cannot give up lying on your back. Because high pillows will disrupt the position of your spine and cause you to wake up with neck and shoulder pain in the morning. In these instances, the utilization of memory foam pillows can assist in preserving a more optimal spinal form. Who shouldn't lie on their back? If there's a sleeping pill, it's not recommended to lie on your back because the airway will narrow. If pregnant, we do not recommend lying on back because placenta will disrupt heart circulation and disturb flow of blood to heart during sleep. We generally recommend pregnant women to lie on their side, right side or left side. If you are pregnant, you can lie in the position you feel most comfortable in. Generally, lying on your back is not recommended for a pregnant woman. If you have lower back pain, lying on your back can reduce these pains. If you wake up with severe back and lower back pain from sleep, then you can choose to sleep on your side. Now let's move on to the worst sleep position. The worst sleep position is sleeping on your stomach, which is rarely slept in the society. Sleeping on your stomach is the worst position. Why am I saying this? Because lying face down puts pressure on our organs. We apply pressure to our rib. We make more effort to breathe while sleeping. When the effort we put into breathing during sleep is high, the quality and efficiency of sleep decrease. Upon waking, we can breathe excessively. We may wake up with pain in our ribs. Generally, we prefer not to sleep on our stomachs. If you also have neck pain, the pillow will usually increase your neck pain because it will put pressure on your face and spine. If you can't give up sleeping on your stomach, you must definitely reduce the size of the pillow. At the same time, sleeping on your face can increase wrinkles on your face by directly contacting the pillow. If there are problems like reflux, that is, if there are some problems related to the bowels being full, lying face down can increase these complaints if acid escapes in our esophagus. Should not anyone lie in a prone position? In certain spinal problems, lying in a prone position may be more advantageous in certain lower back and back problems. If you have a serious spinal problem and wake up with severe pain when lying on your back or side, you can choose to sleep on your stomach by consulting with an expert. So what is it? The position of sleep is important. I lie on this side, I will continue to lie on that side. Seems it wasn't the right understanding. Everyone has different sleeping positions: pregnant, sleep disorder, refractive error, heart disease. These are all factors that really affect sleep position. Generally, when I look at the studies, I can say that the individuals who lie down are the healthiest. Sleeping on your side is the best position, but if any of the mentioned factors related to side sleeping are present, it may not be the right option for you. Not everyone needs to lie down. If you have issues like reflux and experience a burning sensation in the gastrointestinal system when lying on your side, then lying on the opposite side might be a more suitable choice for you. Sleep is precious. The sleeping position, occupying 1/3 of our lives, is vital for our health. If you have one of the previous situations, find your ideal sleeping position and try to sleep in that way. If you are happy with your sleeping position and if you are in one of the ideal sleeping positions, then you can continue sleeping like this. The people I want to pay the most attention to are those who take sleeping pills. People with sleep apnea should stop sleeping on their backs. 2. Pregnant women. Avoid sleeping on back or stomach. Be mindful of sleeping position in these scenarios. Don't forget to subscribe and enable notifications. Goodbye.